Hi, good day, guys. Welcome to my channel. Once again, this is Dr. Paramount, a go-to destination for orthopedic insights and practical analysis tools. Last week, we discussed about the conference lecture about many fractures in the body, dislocation, all sort of orthopedic-related conditions, as well as fractures that are not to be immobilized or encased with POP. So if you need more knowledge about this, you are free to go back to that lecture and just try to get some things as far as conservative management of fracture is concerned. So today I'm going to be moving to another aspect of this conservative management, talking about in orthopedic setting. So there are many bones in the body and each one of them can be fractured. Like we always say, the fracture is a break in the continuity of any bones in the body, and they can be fractured. So we have many bones in the body. We have long bones, we have short bones in the body, we have irregular bones, we have sesame bone, then we have flat bone. So today I'm going to be moving to another aspect of management of fractures, which is going to include the bones of the hand, the wrist bones. So if there's a fracture to that side, what are the management, what are the kind of management are we going to do? Is there any conservative method of holding those fractures? So I'm going to be talking about ulnar gutter splints. Ulnar gutter splint, that's what I'm going to be majoring about today. So when we talk about ulnar gutter splints, what are we trying to say? What are we using it for? What are the indications for ulnar gutter splints? Now, in fracture management, so there are bones that we call carpals, there are bones that we call metacarpals, and there are bones that we call phalanges, and that's going to be where I'm going to be talking about today. So here, I have metacarpals here that I'm going to be talking about. So when we have fractured metacarpals, that is when we are going to apply ulnar gutter splint that I've talked about. We have 5 metacarpals in the body. Little anatomy knowledge now. We have 5 metacarpals in the body. We have metacarpals 1, metacarpals 2, metacarpals 3, the metacarpals 4, and metacarpals 5. So when ulnar gutter comes in is when we have a fracture to the 4th and the 5th metacarpals. That is, this is the 4th metacarpals and this is the 5th metacarpal. So when we have the 2 fractures of these metacarpals, we do ulnar gutter splints. Now the fracture occurred on the metacarpals. Where are we including the ulnar? Because in the name implies ulnar gutter splints. The names, where are we putting the names there? Why can't we just say metacarpals gutter fracture? The reason why we have to put the ulnar there to make ulnar gutter is just because when you trace these 2 fractures, the metacarpals 4 and 5 backward, they are going to fall on the ulnar side. From the knowledge you have in anatomy, you should understand that the forearm bones are made up of 2 long bones, which are ulnar and the radius. This is the ulnar, this is the radius. So if you stand in anatomical position, this is anatomical position. So the ulnar will fall to the medial aspect, which is closer to your body, while the radius falls to the lateral aspect because it is far away from the midline. Now, if you trace it backward, it falls on the ulnar. That's why we call it ulnar gutter. Even if you want to forget what the fracture is all about, you can actually use the name ulnar gutter. Trace the ulnar to the front side of the wrist to the metacarpals. You understand where the fracture is located. When you trace it to this side, you get to the metacarpals 4 and metacarpals 5. On the other hand, when we have fracture 2nd and 3rd metacarpals, for instance, if you trace it backward, you're going to follow the radial space. So that way we have radial gutter. But today I'm going to be talking about ulnar gutter only. So metacarpals 4 and 5 are the one that we say they are when they are fractured, we have to apply ulnar gutter splints to it. So when metacarpals 4 is fractured only, we still do ulnar gutter splints. Metacarpals 5 is fractured only, we do ulnar gutter splint as well. When both of them are fractured as well, we do ulnar gutter. But there's something about that thing. When metacarpals 4 only is fractured, that is this place, you make sure you immobilize the 3rd metacarpals. Although the 3rd metacarpals is free, it's not fractured. But why are we including the 3rd metacarpal that is free? Just for it to have more support. You are supporting it from the left side, then you are supporting it from the right side. So when metacarpals 5 is fractured, you already supported it with metacarpals 4. When metacarpals 4 is fractured, you have to support it with metacarpals 3. So while doing that, you have to put the 3 metacarpals in the ulnar gutter splint. So the way POP circular cast is applied that I've said in my previous lecture, it has to be applied in a circular manner. That is, you apply it like this, you encase that particular limb. In applying POP, you have to cover all the limbs. So, under gutter splint is not applied to encase the whole particular limb. It is applied to encase some part of the limb so as to provide support, the adequate support that that limb actually needed at that particular time. So, splint can either be for reinforcement to add more force, like I said the other time, or for application for the whole immobilization. It can be for that as well. So when I've told you indication that ulnar gutter splint is applied when there's a fracture to the fourth and the fifth metacarpals, or there are injuries to that fourth and fifth metacarpals as well. And there's something called boxer's fracture, boxer's fracture. So when boxer's fracture happens, we go for ulnar gutter as well. What is boxer's fracture? When there's a fracture to the neck of the fifth metacarpals. What am I trying to say? This is metacarpals 1, 2, 3, 4, 5. So when there's a fracture to the neck of this metacarpals 5, so that is what we call boxer's fracture. So that is, we can use ulnar gutter there as well. And there's something called Dupuytren contracture. Dupuytren contracture is actually talking about the condition that is affecting, that used to affect the hand and the wrist when there is contracture, especially on the fourth and the fifth metacarpals as well. There will be contracture of some ligament there and some tissues underneath. So when all this happen, we go for ulnar gutter splints. So how do we apply ulnar gutter splints? How are we going to apply ulnar gutter splint? Ulnar gutter splint is applied to the, at the hand aspect of the limb, the wrist aspect, the hand, the whole phalanges most of the times. Now, the splint is going to immobilize the 2 digits here, starting from the phalanges. When you start with your padding, the padding must not take these 2 phalanges together. Padding these 2 phalanges and continuing in this manner can lead to maceration, because the 2 digits will be touching themselves, which will later lead to ulceration, maceration to ulceration. So to avoid that to happen, you have to pad this place separately, or put a autoband in the middle, at the middle of the 2 phalanges, or pad this place separately before you now combine them together. Just pad them. Then you stop the padding at the mid shaft of the ulnar radius, the shaft of the ulnar radius now. So when you are done with your padding, then you must have measured your splint from here to here. You must have measured it. Then you place it to the particular side of the limb you are trying to immobilize. Then after that, you apply your crepe bandage to hold the splint firmly to the limb. So with this, it's going to immobilize and at the same time support and at the same time prevent movement of that fractured area till healing will be confirmed. And the duration of this is not going to take longer time, like any other fractures in the body of either long bones or some bones in the body. This will take more than 2 to 3 weeks most of the times. Even when the patient is not even an adult patient, is more or less for pediatric patient. So it's going to be ranging from 2 to 3 weeks to 4 weeks most of the times. So these are the managements you are going to get when you have a fracture to the 4th and 5th metacarpals, or when there is any injury to that particular place, we call for ulnar gutter splint. So these are the conditions that happen. So when you finish the application, of the splint, you ask the patient to position the hand like this, then use collar and cuff. Your suspension, use collar and cuff to suspend the hand so as to prevent movement of your patient, so as to prevent movement of the fracture that has happened. So that is going to be the end of the lecture for today. Don't forget what we are discussing today. We are talking about ulnar gutter splint. And what is the essence of this ulnar gutter splint? What are we using it for? We're using it for the fracture of the metacarpals 4 and 5 to be precise. And also when there is a spot injury, when there is a boxer's fracture is where it happens. And when there is a Dupuytren contracture, we use ulnar gutter splint. And I told you where the ulnar is coming from. It's actually coming from the aspect of the ulnar bone. We have a trace of the ulnar bone to the fracture site. I told you when there is a fracture to the 3rd and the 4th, the 2nd and the 3rd, this 2nd and 3rd. If you trace it backward, you trace it to the radius. But when there's a fracture to the 4th and the 5th, you trace it back to the ulnar. So that is actually talking about ulnar gutter splint. And I told you that when there's a fracture to the 4th metacarpals only, you have to include the 3rd metacarpal so as to serve as more support. So we will see more than this today. Next week, I will be talking about some other fractures that has to be managed with splint as well. So feel free to go over the lecture again and just try to get what you need to get there. So this will be the end of the lecture today. Don't forget to subscribe to this channel and don't forget to share and like and comment as well, because it is only on this side I give you conservative management of fractures, and that is what I will continue to do. That will be all for now, guys. Feel free to go over the lecture again and try to get what you need to get. See you in the next class.